Thanks for joining us. My name is Ali Call. This is Module 5, and we will discuss Larry's case and his return to school from hospitalization. As you can see here, these are the authors of the module, and on the bottom, you see the BIRCh Project leadership. Hello, everyone. Once again, my name is Alec Hall. I am a second-year doctoral student studying school psychology at the University of Massachusetts, Boston. I'm from Coney Island in Brooklyn, New York City. So please pardon my accent. I have been working with the BIRCh Project for approximately the past year. Before beginning with our content, I would like to introduce the BIRCh Project to those of you joining us for the first time for this module series. The BIRCh Project is a behavioral health integrated resources for children's project. Its mission is to provide professional development and resources for schools, as well as strengthening coordination of behavioral health support across school and community agencies. The BIRCh Project is led by faculty members from both the University of Massachusetts, Boston and the University of Massachusetts, Amherst, and is sponsored by the Boston Children's Hospital. For more information, please check out our website at umb.edu/BIRCh. Okay, so this module, we will be discussing the case study of Larry. He is a senior 12th grade student who's 17 years old, who attends an affluent suburban high school in Massachusetts. He identifies as white and male. His interests are in football. Strengths described by his football coach as funny, hardworking, and passionate. During this year's football season, he has attended weekly parties that involve drinking alcohol and opioid use. From a young age, Larry has been set on attending college in Boston to play football. After receiving his rejection letter, his symptoms of depression increased with severe anxiety. These symptoms included excessive sleepiness resulting in tardiness and sleeping during class, missing his off-season workouts, staying in his room for long periods of time at home, and using alcohol and opioids outside of school at weekend parties. So more continued challenges, which led to his hospitalization. One morning, Larry's mother found him unconscious in his room, and he was rushed to the hospital, where staff determined that he was suffering from an opioid overdose. He was discharged after 3 days, after his vitals were stable for 24 hours, with recommendations for outpatient mental health and substance abuse treatment. Larry had weekly sessions with the school counselor to discuss college options, and monthly sessions with the school psychologist to review his 504 plan with asthma and assess an assessment for Larry's risk level. He has weekly outpatient therapy sessions and bi-weekly meetings with the licensed drug and alcohol counselor, the LDAC, on his alcohol and opioid use. Larry meets with his football coach for 15 minutes during the week before the school day starts to talk about how he's doing. If he misses school, his football coach will call his home. His school social worker also does biweekly outreach to all of his service providers. For academics, Larry has difficulty attending class throughout the week. Larry is behind in most of his classes, but not too far behind to the point where he's at risk of graduating high school. Larry will also have the support from his school counselor and his peer tutor, who's also his teammate, named Sean. Next, we will talk about equity and social justice considerations. Larry has had a history of benefiting from privilege, whether it be racially or financially. It may be hard for him to process when systems that he relied on for his success fails him, such as being denied from his dream school. While Larry lives in a home with both of his parents, they tend to work long hours to sustain Larry's lifestyle, which causes them to express low engagement in his academic needs. His football coach has stepped up in place of the parent as a caregiver to make sure that his academic needs and personal needs are often met. Because Larry comes from an affluent background, he is able to purchase high-priced drugs such as opioids in high amounts, which can put him at risk for overdose. So here you can see considerations for teaming and planning. And these are the phases that are outlined. You have planning, you have the welcome back meeting, the hospital to school transition plan implementation, which will last approximately 6 to 8 weeks. You have the progress monitoring team meeting. You have the hospital to school transition plan implementation monitoring, which will also last from 6 to 8 weeks. And then you have the planning next steps team meeting. And I will be going through all of the phases of the intervention. So the first phase is the planning. So during this phase, Larry's team will be identified. So we can take a look at who's on his team. His school counselor, school psychologist, licensed drug and alcohol counselor, the LDAC, outpatient therapist, his football coach, his parents, and the hospitalization contact. Okay, so now that we have reviewed, Larry's team, what also needs to be reviewed with Larry's team is confidentiality, since not all team members have a mental health background or a service provider background. In Larry's school, the school counselor, school psychologist, and the school social worker will serve as point personnel for initiating Larry's transition process. The school social worker will gather the contact information for Larry's transition team, which will include everyone mentioned above: school counselor, school psychologist, Larry's football coach, his outpatient therapist, his LDAC, and will provide weekly updates to his parents. The school psychologist will then coordinate a welcome back team meeting with all of the team members, including Larry, to discuss a plan to support him in this difficult his difficult period. So things to consider before the meeting. The school psychologist, school social worker, and school counselor will fill out the transition protocol with as much information as possible about Larry. Demographics, missed instructional time, current academic progress, and attendance records. The social worker will be in touch with Larry's coach and parents to share the following information. The hospital to school transition meeting process, the purpose of the meeting, preferred method of communication, and addressing any immediate needs for support. Please ensure that translation services are available for communications if needed. Larry and his parents are very fluent in English, so these services may not necessarily be needed for Larry's case. So the school team will need to collaborate with Larry's coach and parents to obtain permission and signatures for releases of information prior to obtaining therapy records and speaking with the outpatient and LDAC. So the welcome back meeting, part one. So this is a meeting with the entire team, family, and Larry. So at this meeting, the hospital to school transition protocol is in review. Larry's coach has stepped up to serve for some roles for the parents since they are frequently working. During the initial team meeting, Larry's team will convene. So everyone listed above and completed along with the family handout, which will be sent home with Larry's parents and his coach. Larry will meet with the school counselor, school psychologist, or the school social worker to complete the youth action plan the next day. At the end of the meeting, the next meeting date is set and a plan for following up with Larry's coach and parents will be set as well. So this is part two of the welcome back team meeting with the school-based team. So the school-based team makes the school counselor, school social worker, school psychologist, and Larry's football coach. So the school team will reconvene to complete the hospital to school protocol and any supplemental documents that need to be outlined. The team will complete the phases of hospital to school transition document, and they will also review Larry's youth action plan. Because Larry has been hospitalized, tier 3 services in the multi-tiered system of support model will be considered upon completion of his team action plan. At the end of the meeting, the next meeting date will be set and a plan for following up with Larry's coach will be outlined. So the hospital to school transition plan implementation phase. So at this phase, the transition plan will be implemented. And this is Larry's process into transitioning back into the school setting. As you can see here, Larry's safety plan is also outlined, which will include 2 counseling sessions a week with the school counselor to identify and manage any triggering thoughts or behaviors. Also, a nonverbal pass will be used to communicate with teachers when Larry feels he has the need to move into a safe space for additional support. This safe space can be the school counselor's office or his coach's office. In this phase of the transition plan, We will, outline the supports that he needs in the level of support. So the team determined that Larry initially needed these supports. So for academic stamina and attendance, Larry will be given moderate supports as he will attend partial days of school. Next will be behavioral health supports, which will be moderate as well, which will come in the form of case management, the welcome back meeting, check-ins, and counseling sessions. Then you have instructional supports, which are pretty minimal, extra time on assignments and peer tutoring, preferably by his teammates. And as we mentioned earlier, Sean will be his peer mentor, who's also a teammate of his. So Larry's team, therefore, recommended that Larry specifically will attend school part-time from 9 a.m. to 2 p.m. with the proper supports in place. The team determined that after minimally 6 weeks of intervention, Larry's hospital to school transition plan will then be reassessed, and for possible transitioning to full days of school and continued mental health and substance abuse treatment. So, for more information about this, please see a completed protocol for Larry for more detail. Again, this is another snapshot of the hospital to school transition plan set in place for Larry. As you can see, Larry has self-advocated supports, which include, again, morning check-ins with coach, extra time to complete his work, meeting with his peer mentor / teammate, Sean, having a safe space such as his coach's office or the school counselor office, a safety plan for whenever, he feels the urge to use substances or alcohol. So those are his self-advocated supports. In terms of academic supports, having extra credit assignments for each class he's in. As mentioned before, extended time on assignments. And he will also meet with his peer tutor and teammate Sean. For behavioral supports, he will have a pass to show teachers when he feels like he needs to use the safe space. When it comes to mental health supports, daily check-ins again with the football coach, weekly counseling sessions, or with the school counselor, weekly sessions with the outpatient therapist, and bi-weekly sessions with LDAC. For family supports, Larry's football coach will meet with the team regularly, and his parents will receive monthly updates from his service providers and his coach on his progress, as well as frequent communication with the school social worker. And if you would like to see more of this plan, please, see the sample provided for Larry for more detail. As you can see here, this is a outline, or rather a chart of the interventions that Larry's receiving, the dosage, so how often Larry will be receiving these interventions, data collected for these interventions, and the people responsible for implementing these interventions. So the next phase is the progress monitoring team meeting. So at this time, the entire team will convene to discuss Larry's progress, which will consist of Larry, school counselor, school psychologist, his LDAC, his outpatient therapist, football coach, and his parents. Larry's academic, mental health, substance abuse progress will be discussed in addition to the next steps. The school social worker, will reach out to Larry's parents and his coach to check in to see how things have been going on at home. So with these updated goals, we would invite the family back for another meeting for Larry in approximately another additional 6 weeks. At this meeting, progress will be, reviewed again, and the phases of transition document will be reviewed. And Larry's progress towards his goals will be assessed. So again, this is just more information on the hospital to school transition plan and implementation progress monitoring. So, as you can see here that Larry has rejoined the school community for, partially of the day as he attends his outpatient and substance abuse services. All of these services are put in place. So, as we can see more specifically, Larry will meet with his guidance counselor. He will continue to have these check-ins with his coach. He will, continue to have these additional, time on his assignments. And as mentioned before, attend partial day. And then also he can be a part of the after-school tutoring program. His school social worker will do weekly check-ins with his football coach and the outpatient providers that he has, and monthly with his parents. Sorry, weekly. The school psychologist will also check in every week with Larry's teachers to closely monitor his academic progress. So this is one of the final steps of the planning next steps team meeting. So after an additional 6 weeks, the entire team reconvenes to discuss Larry's progress. These are things to consider, such as the 504 plan, action steps to be completed by the team, discuss which supports will be continued, and progress monitored, set next date for the next meeting to reconvene. And this would pretty much, be an additional meeting to kind of serve as an assessment for Larry's progress and current level of functioning with supports set in place for Larry. So we want to be clear that this tool will be utilized in a manner that is most responsive, relevant, and feasible for your school community. As we know that no school community is the same. The BIRCh team recognizes limitations and the negative impact of language and how that can be perpetuating inequitable systems. Please feel free to rename the titles of certain documents and make other adjustments in language throughout the protocol if your team feels it should be more culturally responsive or appropriate to the needs of your school community. We would like to thank you for attending, and if possible, complete the evaluation form. For any questions, please contact us at you know umb.edu/BIRCh. You can also subscribe to our mailing list. For email inquiries, you can email our program director, Catherine Doherty Kurtz, at birch.project@umb.edu. And yes, thank you so much for listening to Larry's case. Once again, I am Alec Hall, and take care, and thank you for all the work and support that you do for your students.